If your child is constantly having catarrh, breathing through the mouth, having repeated ear infections, or snoring loudly at night, then today's video is for you. We are talking about enlarged adenoids in children today, what they are, the signs to look out for, and when to see a doctor. Kindly stay with me to the end of this video because many parents mistake this for a common flu. Adenoids are masses of tissue located at the back of the nose, high up in the throat, and they are part of the immune system. Their job is to trap germs and fight infections, especially in children. Adenoids are usually bigger in children between the ages 1 and 6 years. But the problem is when they become too large or chronically infected. When this happens, they block airflow and cause symptoms. Some of the things that can cause enlarged adenoids are allergies, chronic sinus infections, and frequent colds. There's also genetic tendency, whereby sometimes a child is simply born with relatively large adenoids. If a child keeps having infections, the adenoids keep swelling and they may not return to normal size. Now let's talk about the signs to look out for as a parent. If your child is having persistent nasal discharge for weeks or months, even after medications, then you should consider enlarged adenoids. Loud snoring. Snoring in children is not always normal. If it is frequent and loud, then you have to check it out. You should also look out for pauses in breathing during sleep. If you notice your child stops breathing for a few seconds while sleeping, then you have to seek immediate medical attention because this may be sleep apnea. Look out also for frequent ear infections. You know the adenoids are close to the ear tubes, and when the adenoids are enlarged, they block drainage and cause repeated ear infections. There's also nasal voice. That is, the child may sound like they are talking with a blocked nose all the time. There's also poor sleep always or irritability. Because of poor breathing at night, the child may be restless, tired, or irritable during the day. These are the complications if enlarged adenoids are not treated or ignored. The child may have hearing problems, delayed speech development, or sleep apnea. In diagnosing enlarged adenoids, a doctor may check the nose and throat. He may use a small camera to look at the adenoids and then recommend an X-ray and also check the ears. There are treatment options, but they depend on the severity. Mild cases may be treated with nasal steroid sprays, saline nasal drops, and allergy treatments. If symptoms are severe or persistent, the doctor may recommend adenoidectomy, which is a surgical removal of the adenoids. The surgery is generally safe when done by specialists. Most children improve significantly after the surgery. They get better sleep, better breathing, and fewer infections. Please see the doctor immediately. If your child is having a catarrh that lasts more than 2 to 3 weeks, if they are having sleep pauses, if they are breathing with difficulty, or repeated ear infections, please do not also ignore chronic symptoms. Share this video with other parents and kindly subscribe to this channel for more trusted health education. Thank you.
Thanks for watching. Keep supporting me.